here on this channel. The topic today will be the EACTA Fellowship Program with the title EACTA Fellowship More Than an Educational Campus. A very warm welcome from me. My name is Jan Schreiber. I am the local program director of the EACTA Fellowship in Maastricht here in the Netherlands. And I'm sitting here also on behalf of my colleague Gabor Erdoes from Bern in Switzerland, who unfortunately cannot participate in this call due to some issues. So what's the topic of tonight? By the end of this webinar, you will be able to better understand some organizational issues which might be important, especially for non-European, non-EU fellows, and you will learn about different experiences from different countries. We will talk about the education, the training of non-technical skills, especially about human factors and team leading and the role of teamwork during the fellowship. And you will learn about how to maximize your improvement during a fellowship program by listening to a personal experience. So just organizational issues before we will start. If you have any questions, please use the question and answer chat box. So we will try to answer all questions at the end of the 4 talks. We will have 4 excellent speakers tonight with 4 talks, but we will do the question and answer round at the end of this webinar. And I would like to notify you that if we cannot answer every question, due to reasons of time, for example, we'll post the answers on the EACTA website and via social media. But now we'll start with our first speaker. Our first speaker is Dr. Anna Flo Forna from Leipzig in Germany. She is local program director of the EACTA Fellowship in Leipzig at Leipzig Heart Center. And she will talk about important organizational issues for non-EU fellows from the perspective of a program director. Anna Flo, please, your talk.
Good afternoon, ladies and gentlemen. I am Anna Flo, and I am co-director of the fellowship program in Heart Center Leipzig in Germany. In my lecture, I'm going to talk to you about our experience with the organizational problems facing us and our fellows who come from non-EU countries. The journey begins when an anesthesiologist is particularly interested in cardiothoracic anesthesia, one of the subspecializations of anesthesia that requires special training. The expertise necessary to perform anesthesia in cardiothoracic surgery depends not only on personal training, but on many other factors, such as epidemiology of cardiac and thoracic disease, surgical needs and limitations, availability of material, technology, and personal resources. All these factors can influence the extent of knowledge and the amount and type of skills acquired during the training, and might limit the expertise acquired. For many cardiothoracic anesthesiologists who wish to expand their expertise, to participate in a cardiothoracic anesthesia specialization program abroad is a dream. Going abroad for work offers a personal and career opportunity. That it's very appealing and promising, but at the same time, it's not an easy way. One is going to be confronted with a lot of unexpected difficulties and has to deal with the challenge of getting out of one's comfort zone. The application process is on one hand very exciting and full of great expectations and hopes. On the other hand, it can be exhausting and sometimes even frustrating. Once a decision to go abroad for specialization is made, it's important to choose a center to fulfill the expectations. Nowadays, EACTA is offering a structured fellowship program to provide the opportunity to participate in a comprehensive training in cardiothoracic and vascular anesthesia, in centers where anesthesiologists are exposed not only to a wide variety of pathologies, but also to the newest surgical procedures, technologies, and resources. The possibility to take part in such an interesting training programs attracts anesthesiologists from all over the world. EACTA is offering the fellowship in different European countries and is planning to expand the program to non-European countries like Brazil. But not all the centers offer exactly the same training. There are centers that offer a comprehensive overview of cardiothoracic and vascular anesthesia, and other centers that are more focused on only cardiac or cardiovascular anesthesia. There are centers with a high volume of cases that have a very dynamic environment, and consequently the work is harder. That can be seen as a disadvantage or as unnecessary. There are also small centers, more comfortable, but with exposition to fewer cases. So it is important the applicant gathers enough information in order to choose the center that fulfills the goals of his or her career and that suits his or her expectations. Because the fellowship is offered in different countries, an important point to pay special attention is the spoken language of the hosting country. The applicant has to contact the hosting center to get more information. The program director plays in this step a dual role. On one hand, the program director has to provide the information for the applicant in an objective way, answering the applicant's question regarding the fellowship, informing the applicant about the organizational issues, case volume and variation, teaching process, optional additional training such as pediatrics or the ICU, and the possibility of doing research. The information shall include the working load, remuneration, and a detailed formalities process. On the other hand, the program director, through asking questions, must estimate the applicant's experience in anesthesia and in the field of cardiothoracic anesthesia and his or her expectations of the program, and have to gather enough information as to decide if the applicant meets the requirements to receive the position and is going to fit in the department. The best way to achieve these goals is that the applicant visits the center to get a real view of the department and the environment. In addition to a formal interview with the director, the applicant gets the opportunity to meet the current fellows, the other anesthesiologists, surgeons, and nurses of the team. The problem is that for a foreign applicant, it is usually difficult to come for a visit, and that's why we conduct a first contact Skype interview. With the information gathered during the interview, the CV, and recommendation letters, we have to decide if the candidate is suitable for the position. At the same time, the applicant must decide if the position is suitable for him or her. If there is an agreement of both sides, for those applicants unfamiliar with the local language, the process begins with learning the language. In Germany, the level of language required to begin the administrative process is B2 with an official certificate, and a C1 medical level is required to receive a working permit. The specific exam is performed by the medical association. In our experience, the time required from knowing just a little bit of German to the B2 level is variable, but it takes at least 6 to 8 months if one can invest enough time, although most of the applicants need at least 2 years. From our point of view, this is the most unpredictable phase of the whole process. Actually, the longer the candidate needs to learn the language, the more likely that the candidate quits. So it's important for the fellowship organization to maintain a closer contact with the applicants who are learning the language in order to follow up the process. There is an official list of documents to be sent to the provincial authorities. All documents must be in original and certified translated. Depending on the country of origin, it can take a long time to accomplish the formalities, so it must not be left for the last moment. It is important the applicant complete all the formalities during the period of language learning. As soon as the applicant obtains a B2 certificate, the hospital can offer him or her a conditional position. It is conditional because the employment permit can only be given after passing the C1 medical examination. All the documents, including the B2 certificate and the job offer, have to be sent to the provincial authorities to be checked. The provincial authorities register the applicant in the medical association for the C1 medical language exam. With the appointment from the medical association, the applicant can apply to get the visa to travel to the country in order to take the exam. And it's important to mention that this visa will be issued only for the exam and not for work in the country. After passing the exam, the medical association sends the result to the provincial authorities to proceed with the issue of employment permission. All that process can find a lot of obstacles in all the steps. The most difficult steps are the revision of the documents by the provincial authorities and the expedition of the visa. Nowadays, Germany does not approve the medical degrees of non-EU countries. So in order to be accepted as a physician, it is necessary to pass a medical examination. But for the goal of the EACTA Fellowship, the provincial authorities can issue an employment permit with a start and expiration date according to the 1 or 2 years job offer. A prolongation in time is not possible. The applicant has to send the employment permission to the hospital. The hospital will issue the contract, and with the contract, the applicant can apply for the work visa. It is important to keep in mind that depending on the country, it can take 1 to 6 months for the embassy to issue the work visa. That means that the starting date of the employment permission should not be earlier than the date of the visa. That usually obliges the applicant to fly back home and wait for getting the visa. After going through all that long process, the applicant finally can start the fellowship program. The most important organizational problem from our point of view is not knowing how long are going to take all the steps till the fellow get the work visa. It usually takes 1 to 4 years, and that makes a planning of position very difficult. Additionally, the beginning of the fellowship is a big challenge as well, because the fellow must face working in a new environment with an unknown team, using a newly learned language, and depending on where the fellows come from, a cultural shock as well. Having experience in cardiothoracic anesthesia will help not to feel completely lost, but at the same time, it can be a disadvantage, since it can impede the acceptation of new methods, procedures, and protocols. Additionally, the lack of verbal fluency and the lack of self-confidence in using the language makes the team work difficult and prevents the fellow from gaining the operating team's trust. One of the most important roles of the fellow's director is to prevent conflicts and to support the fellow to feel comfortable and avoid frustration. So the fellowship can be quite a challenge at the beginning, but after a while, when a good acceptance from all parts of the team has been gained, a smooth progression of the program can be expected, and the fellows will hopefully meet their expectations. The way is long and full of obstacles, but at the end of the day, it is worth trying. Thank you very much.
Now, thank you very much, Anna Flo, for your excellent presentation. And before we get we'll have our next presentation, I would like to remind you to leave all your questions in the Q&A box, in the chat box, that we can answer them at the end of the 4 talks. So now we'll turn on to Luis Vazquez, originally from Guatemala City in Guatemala, who has recently finished his EACTA Cardiothoracic and Vascular Anesthesia Fellowship in Milan, in Italy, and who is now working as a clinical fellow at the Western University in London, Ontario in Canada. And Luis will talk about the fellow's perspective on the important organizational issues of the fellowship from a viewpoint of fellow for non-EU fellows. Luis, please.
First of all, I want to thank EACTA for giving me this great opportunity to present an important topic. And at the same time, I want to give some insight to anyone trying to apply to the EACTA Fellowship Program. The title of the talk is Important Organizational Issues for Non-European Fellows, the Perspective of a Fellow. I just want to point out that it's not about if you are or not European, rather than where did your training took place. So if you got to train outside the host center country you want to apply to, this talk is made for you. I have no conflict of interest, nothing to disclose. And the outline of the talk is, first of all, why applying to the EACTA Fellowship Program, in a way, as a 14-year trainee, is it worth it to go through all the things, a fellow needs to go to apply and be successful? How to choose your fellowship, what challenges to expect, how to overcome them, and some final thoughts. So from this first image, we can learn how the EACTA Fellowship Program has expanded around the world. And now there is a host center in Brazil. It also helps me to make the point I was discussing previously. If you got trained outside the host center in which you want to apply to, then you're going to have different challenges in a different path that someone who got trained in the same place where the host center is. So first of all, why applying to the EACTA Fellowship Program? And I always like to bring up Dr. Atul Wande, who wrote the checklist manifesto, the checklist we use every day in the OR room. And when he in his TED Talk explains how he got there, he recounts his personal experience and how after a couple of years of being a surgeon, his complication rates began to increase, and he wondered why. So he looked for a senior surgeon to watch him and give him advice, how he could get better. And at that point, he understood the importance of a coach, of a mentor. And I think that the EACTA Fellowship Program actually has that. You're going to get mentorship to get better, not just to learn, cardiothoracic vascular anesthesia, but how to do better your job as an anesthesiologist. A second point that the EACTA Fellowship Program is going to give you is the opportunity to combine knowledge. If you were trained, in North America, South America, or any other place, and you go to Europe, you're going to find that things are done slightly different as how you are used to. And I have a couple of examples of that. This paper published a couple of years ago was a global survey of anticoagulation management during cardiopulmonary bypass. And if you see, the response of New Zealand and Australia and South America and Europe, you're going to find that they don't agree in the same thing. So there are slight differences in the responses of how they manage the anticoagulation during the cardiopulmonary bypass. Another example is if you compare the guidelines of anticoagulation of North America and Europe, you're going to find a couple of differences, maybe not big things, but things that are done differently. Now, if you're able to combine, the knowledge that you already have with the knowledge of how things are done in Europe, then this is going to be a fortitude, a virtue, and it's going to give you surplus. So this is a great advantage of going to the EACTA Fellowship. And a third point is that you're going to be part of an association that is committed to provide high quality training, cardiothoracic vascular anesthesia, and intensive care medicine. The past year, I had the great opportunity to join the board of directors of EACTA to write this interesting article, which I advise you to read, about the transition and how the fellowship has transformed into today a place that is and gives state-of-the-art training. Shortly after, it was published the first curriculum, which now standardized the training among all the host centers that are certified by EACTA. And this is a big step. It's something that EACTA is going to give you after the application. So how to choose a fellowship? We already discussed, that EACTA is going to provide and is going to be worth going through all the things to apply. Now, how to choose your fellowship? under my personal perspective, I think that these 5 points, address the important things to consider. First of all, a fellowship has to have a flexible clinical schedule that is going to provide, the opportunity for you to achieve your short and long-term goals. Second, a fellowship has to be able to provide you with a high volume of patients to be able to actually learn cardiac, thoracic, and vascular anesthesia. The fellowship has to be board-oriented didactics and has to have strong mentoring, as we mentioned before. And at the end, and not for that less important, the environment. You need to be in a comfortable environment to actually be able to understand, study, and work. A couple of years ago, this paper published in order for those trainees looking to achieve an academic career. And they point out essential ingredients to get that. And one of those is mentorship. So again, I'm sorry that I insist so much in that, but under my personal experience, that is one of the most important things that you can achieve after applying to the fellowship. Good. So what challenges to expect? So there are going to be many challenges that you can find in a way towards the application during the fellowship, but if you want to, you can crush all of them. So it's going to depend on your background and where are you applying. And the background, I refer, for example, to training. Where was your training? What type of interventions you did? What experience do you have? What knowledge and what exams you were able to clear in terms of research? What skills do you have? Do you understand basic of research? Remember that many of the host centers certified by EACTA are strong in research and have a big background in it. It's worth mentioning your citizenship, which is important in order to get the visa, the work permit of the host center is going to play a role. After that, your language, do you know the language of the host center? Are you able, and have skills to learn that language if you don't know it yet? And for example, right, if your mother tongue, is Spanish and you want to learn Italian, maybe it's going to be easier than if your mother tongue is German, for example. So those are things you want to consider. And the culture, right, is important. As we mentioned before, you want to be in an environment in where you're comfortable, and you want to understand the culture of that host center that you're going to, that you're going to be able to thrive into to be a good fit. The requirements to the EACTA Fellowship Program is, first of all, be a board licensed anesthesiologist. Second, to have an exam that certifies that you're B2 language. And the third and most difficult thing is to have a license to practice medicine in the host country. And this is maybe the most consuming, and hard thing to achieve, but is the only way in which you're going to be able to practice medicine in a different country. So I advise you to begin doing your homework and finding out, exactly what path do you need to take and what documents and what things you need to do in order to get that. Other challenge is the financial support. Remember that there are different, the host centers can offer not support, And also during your transfer, during the first couple of weeks or months, you're going to need some support to survive. So you want to have that in your plans, in your timeline, and be clear how you're going to be able to manage that. Other challenge, and I got it from this interesting paper, is the interview. Remember that you're coming maybe from a different place in which the director of the host center does not has that great background. So you want to demonstrate that you're compatible, that you are a good fit for the program, and that you're going to achieve it through doing a good interview. And I advise you to do that interview in the language of the host center. Even though that English probably is the official language of the EACTA, you want to do that interview in the language of the host center, and you want to demonstrate. You want to go big in that interview to demonstrate. And also you want to discuss if you want to, find a job, in that host center country, or want to go back home, or things that you want to discuss from the beginning. This other paper, which addresses, what tools does a trainee needs to have in order to have a successful application. As you may see there, it's important to point out letters of recommendation. And you want to have good letters of recommendation from people that are well known around the world, and that probably the director of the host center also knows them, right? That is going to give you a push, and is going to, make your application stronger. Remember that relatively few applicants are appointed as fellows because of the high standards and selection criteria, but this has to give you, the drive. This is not a negative thing, but a positive thing in which you need to be convinced that you're able to achieve this, even though that the path is not easy. And one last challenge is the coronavirus crisis. Remember that this has changed our ordinary life, and as well it has changed the schedule of the fellowship. So you can expect some changes, and even to manage some coronavirus patients. So be aware of that, be prepared for that, and discuss it also with the program. Good. So how to overcome all those challenges? So unfortunately, I don't have a silver bullet. I can tell you that you need to be resilient in order to get and to go through the application and the fellowship. I personally love this definition of Angela Duckworth, who talks about grit. And grit actually combines resilience, ambition, and self-control. And those are the tools you need to have in order to achieve and be successful in the application during the fellowship. I highly advise you to review, and if possible, to clear the European Diploma of Anesthesiology and Intensive Care. This is going to point out in your CV, and is going to give you advantage in the application. Before applying, you want to prepare ahead of time. You want to write a timeline and make sure that you understand the deadlines of the application and have all the documents ready. And also, I advise you to show your interest as soon as possible, right? You want to contact the program, you want to contact the director, and you want to tell him, you want to make some noise that you're interested, and you want to go there for them to have a spot for you, maybe even to reserve a spot. So everyone knows that the process is long, it is complex if you're a foreign trainee, but you want to make sure that they know and they're aware of that. do your homework, review the requirements, be sure how you're going to get your visa, your work permit. And for all this, please contact previous fellows. Those are the people that, went through the process and understand is going to give you instant advice of how to achieve all the things. And read literature, understand the research that the host center is doing in order, for you to understand and participate in that. And that's going to be helpful. And as we said before, prepare your language in order to be successful in your application. After applying, prepare your interview. We already talked about this, which is essential that you demonstrate that you're a good fit. You're able to, you're compatible with the program. After acceptance, I can advise you to focus on your introductory period. It's a very tough first month in which you're going to have to work in a new environment with a new language. And it's also a test, right? So you want to go strong in that first month and demonstrate that you're able to go through all the fellowship. And also schedule from the beginning all the requirements that you need in order to get the certification. Remember that there are different requirements like the TE exam and certain amounts of interventions you need to do in order to get the certification. So some final thoughts in order to wrap up. Have clear goals, and not just the goals, but the settings, how you're going to achieve them. Have in mind that the benefits are in two ways, right? You're going to benefit academically, you're going to learn things, but also the host center, is going to benefit of your presence, right? You're going to also show them how to do things, differently, your personality, your culture, all that, is going to benefit for you and for the host center. And always remember that what is delayed is not denied. So keep on strong, be patient, and you'll get there. Thank you.
So thank you, Luis, for your excellent talk. And before we will go on with the next talk, I would like to remind you to leave all your questions in the chat box that we can discuss them with the speakers live after the fourth talk. Our next presenter is Professor Vera von Dossow from Bad Oeynhausen in Germany. She's head of the Department of Anesthesia there in the Heart Center at Bad Oeynhausen, which is one of the largest heart centers in Germany. And she has several academic and administrative appointments, published a lot of publications in highly impacted journals. She's an active member of several national and international societies, and also board member of the subcommittee Transplant and Assist Device of the EACTA. And she's also the local program director, of course, of the EACTA Fellowship in Bad Oeynhausen. And her talk will about how to teach the non-technical skills and how to improve communication during an EACTA Fellowship. Vera, your talk, please.
Good evening, dear colleagues. Thank you very much for the invitation. My name is Vera von Dossow. I'm from Bad Oeynhausen in Ostwestphalia in Germany. And I would like to talk about how to teach non-technical skills and how to improve communication during the EACTA Fellowship. And let me start with high-risk industries, such as nuclear atom reactors or aircraft business, for example. They had lots of bad experiences, and then they developed high-risk industries develop security standards and normative values. So they try to improve the safety. Regarding medicine, we have the Hippocrates, first do not harm. And what does it mean for cardiac surgery patients? It came out with a circulation publication in 2030. It was Joyce Warr who gave a clear presentation of patient safety in the cardiac operating room regarding human factors and teamwork. So it is a safe, scientific and statement from the American Heart Association. And it refers to the human factor in cardiac surgery regarding errors and near misses in the high technology medical domain. This means we have the Swiss cheese. So if the patient enters in the hospital, there's a high hazard procedure and we have lots of failures of information, and at least the risk is death. So this is a fatal outcome that we have to prevent in any case. To improve quality in healthcare, this depends on several aspects. This includes safety, timeliness, efficiency, efficacy, equitability, and patient-centeredness. However, we have to keep in mind that today we have more subspecialties like anesthesiologists, intensivists, pediatric cardiac anesthesiologists. So we have larger groups and disparate roles, and the units have become greater. So it's important to improve teamwork and communication for a good quality outcome of the patients. So this means the ultimate objective should not be to avoid error or harm at all costs, but rather to achieve the best outcomes for the greatest number of sick patients. So the triple aim was published by the Institute of Healthcare Improvement 2011. This means improving the health of the population and enhancing the patient's experiences of care. This means that we have to improve quality care standard of education and reducing and controlling costs. What does it mean now for perioperative medicine and cardiothoracic surgery? It is important to have a clear and consistent communication. If you look at the teams which work together every day, so we have the cardiac anesthesiologist communicating with the perfusionist, with the cardiac surgeon, with the anesthetic nurses. So it's very important to have a clear and consistent communication. There are 6 approaches to improve teamwork. This means subspecialize and replace tribes with teams, sort out the leadership while flattening the gradients of authority, introduce explicit training in effective communication, to use checklist briefings and debriefings and engage in the process, and to promote a culture of respect alongside a commitment to excellence and focus on patients. And last but not least, to focus on the performance of the team and not on individuals. And then I would like to go a little bit more precise in these 6 approaches and give you some examples how to improve communication in a team. First of all, I would like to present you a very old sport called lacrosse, which was used by the Indians to prepare for the war. And these Indians, everyone was fighting for himself. And in the latest 19th, this was becoming a team sport in the universities of America. So this means for today that we have also these teams had a very high spirit, team spirit. And this was focused on a sport to play together and to have a commitment together. And today this means that we have we need patient-centered teams. So it is important that also regarding the evolution of cardiac surgery, you see here we have Gabor, we have Lillehei, we have Christoph Barnard, who did the first heart transplantation. We have similar, parallel to this, the innovations of medical technologies, like the minimal invasive strategies, the TAVI procedures, the heart-lung machine, and also the LVAD implantation. So there has been an increasing amount of technology, technology development, and this means also parallel and similar that the developments in cardiothoracic anesthesia were also important for the history of the whole anesthesia. So all advances that were developed in cardiothoracic anesthesia were promoted the monitoring and intensive care medicine today. And what you see here is the first deep hypothermia patient performed by Professor Dr. Zindler, who was the first professor of anesthesiology in the University Clinic of Düsseldorf. So we have lots of experiences parallel to the cardiac thoracic evolution. So also here, the EACTA is the umbrella of the subspecializing cardiothoracic and vascular anesthesia. But this means not only subspecializing in these different specialties, it means also a member of a heart team. There are several recommendations for a multidisciplinary team approach. This means also to the EACTA Fellowship to receive the TE certification and to train on the TE simulator and the heart, lung, and machine team training. And in this context, also communication and non-technical skills are even important, like the other aspects. And I would like to give one example of a team. It is the Green Lane Cardiothoracic Unit. It was established by Brian Barrett in 1971. And this team was very special because it was small, highly subspecialized, and they had a commitment to consultant-led practice at all hours. And they had a culture of excellence, and they performed even cardiothoracic and vascular surgery, but also pediatric cardiac surgery. And all in this team, and this was they had a very high reputation and pioneering work in the use of homografts for aortic valve surgery and deep hypothermic arrest for congenital heart defects. And what was special in this team? In this team, it was special to have a small team, and every anesthesiologist and perfusionist surgeon participated in most aspects of the work, including postoperative intensive care. And they were supported from cardiologists and nurses and technicians, and the workload of many hours. So, however, even if they had a strong commitment, there were lots of stories where these employees could not have attendance on familiar events, for example, because they have a very strong commitment with their work. And another important aspect is the leadership of flattening gradients of authority, because speaking is pivotal for patient safety. So this means even the most junior person in the OR should speak and have the possibility to speak. And a clear structure is important, as a multidisciplinary committee have standardized approaches to common problems and shared decisions about policy and strategy. And also this improves patient care and outcome. And at least the third very important point is the communication and teamwork, because there is evidence that effective communication facilitates team process. And this means that cooperation, coordination with anticipation of problems or complications, cognition, conflict resolution, and team coaching is essential for an effective teamwork. However, we have to take in mind that communication differs within doctors and nurses. So there might be differences in education and training. They have different communication styles. They have different experiences, educational levels, mood swings, or respect for each other. And their daily routine communication is also diverse because it might be on the corridor, it might be unstructured, might be structured handover or written handover, or at least only a telephone call. So there are several influencing factors that are responsible for the framework improvement. However, it depends on the different styles of communication, and if there's no face-to-face communication, or if the acoustic level or the pressure of time or multitasking is might be a very might be a problem, or if there's no structured handover procedure or insufficient training level, or sometimes there's even a language barrier or educational problem. So most of the schools for the nurses or for the doctors, it's like silos because they are very separated, and then if they start their career to work together in the OR, they have to function as a team. And it's very important to have a good teamwork and a good communication. And what should not happen is the worst case scenario. That means that the issue was communicated, but the problem was not clearly reported or no consequences, and there's no decision-making process. So we have to avoid this, because we know that from studies, most of the causes of sentinel events were due to communication problems. And even this was also shown by the hazard of patient safety, that 65% insufficient communication was due to interruption of work and diversion. The sequelae was delay of treatment, ventilation problems, medication errors, and error with persistent damage. So it should be avoided. And therefore, structured checklists were published by the World Health Organization, like team timeout, that increases patient safety and which is useful in the OR, but also communication during patient handovers, like if you bring a patient in the PACU or the ICU. There's a recommendation to use this S-bar concept and to have also enough time for the S-bar concept. And it's important to have a training on these non-technical skills. So there's a German recommendation for the S-bar concept, which is published by the German Association of Anesthesiology Intensive Care Medicine. And you have 4 items, like the situation, the name, age and gender, diagnosis of the patient, the background, allergies, for example, preoperative medication, comorbidities. And then you're talking about the assessment, and at the end you give the recommendations. And this can be trained in a team process together with the nurses and also with the other doctors. And it should be supervised and measured, and it can also be measured by several tools. For example, the communication items included, they referred to the quality and quantity of the information exchanged during the handover. All the teamwork can be measured as defined as cooperation, coordination, and absence of conflicts among members of the team. And also regarding the leadership, this includes items on identification of the team leader and management of the communication flow during the handover meeting. And also the situation awareness comprises items on shared understanding of the current patient situation and consideration of potential future complications. So it is possible, if you use the handover performance tool, to measure the quality of handover and to improve also the quality of handovers, which increases patient safety in these high-risk patients that we are treating in cardiothoracic and vascular anesthesia. And there's another very important element of teamwork. This is the improvement of the performance of the teams. And there are several aspects like team orientation, team leadership, mutual performance monitoring, backup behavior, adaptability and commitment of each employee. And there are several important things to develop. This is mutual trust, effective communication, and also the shared mental model within the team. So at the end, it is not the focus on the individual, but it is the performance of the focus on the performance of the team. So this means good outcomes depend on all members of the team, and the collective approach to excellence is important, and also to incline the help to each other in difficult cases. So it needs to be a consistent and transparent behavior. We measure this in the EACTA Fellowship Program with the multi-source feedback paper form. And here we measure the communication with the patient, the empathy, the integrity, and also the communication with the team and working with the team. And all these issues are measured or by the instructors of the EACTA Fellowship Program Directors, and all have the goal or the vision that we, during the EACTA Fellowship, develop our fellowships to a leadership position, to become a leadership. And just to show you an example of the Amundsen-Fram expedition, it was an expedition to the South Pole, and Amundsen was a Norwegian researcher, and he had a race against Scott. He was an English researcher, and Amundsen reached the South Pole with all his colleagues and also with the animals, with the dogs. But Scott, for example, he was not very good prepared. He did not reach, he reached the South Pole, but he had lots of colleagues who died. And what came up from the Amundsen-Fram expedition was, if they both would have planned this expedition together, it would have been a greater team and a greater commitment also with the expedition. Thank you very much for your attention. I'm now open for questions.
Now, unfortunately, Vera is not open for questions now. We will have the questions a little bit later. And I would like to remind you to leave all your questions in the chat so we can discuss them after our last talk, which comes from Ralph Dudink. He's a direct colleague of mine working at the Maastricht University Medical Center as a cardiothoracic anesthetist. And Ralph was the first EACTA fellow who has finished his fellowship in our center. So we are very proud of him. He did some training in general surgery and ICU before entering anesthesia. And he will tell us about his experiences and the experiences he made during his fellowship. And hopefully he will have some tips and tricks for you and share his experiences. Ralph, please.
Good afternoon, everybody. First, let me start with introducing myself. My name is Ralph Dudink. I'm a cardiothoracic anesthesiologist in the Maastricht University Medical Center in Maastricht, the Netherlands. And I was actually the first fellow to do the EACTA Fellowship in our hospital. And I was asked to give a small report on how did I experience this fellowship and if I have become an expert after this. So first I will start with a small introduction. I will talk something about what is an expert. Later I will talk about how to become an expert. How did I become an expert? I will briefly talk about the EACTA Fellowship in Cardiothoracic and Vascular Anesthesia. And I will try to evaluate if I'm an expert now after following this fellowship, which is a difficult question to answer, but we are going to try. So what is an expert? If you look the internet, you can find many different definitions of an expert, but all they are quite similar. And they state an expert is somebody who has a broad and deep competence in terms of knowledge, skill, and experience, which you gain through practice and education in one particular field. So there are some highlighted parts of this definition here, which you can see. And first is a broad and deep competence in a particular field based on knowledge, skill, and experience, which you gain through practice and education. So there are many different models in the internet about experts and how to become an expert. One of the famous one is the Dreyfus model of skill acquisition from the Dreyfus brothers from the University of California in Berkeley in the United States. But all are quite similar. All you start in a novice level, of course, and you gain knowledge and you gain practice and you gain skill. And through time and practice, you reach the level of an expert. I will not go very much into detail of this, but you can see here on this slide how you learn from being a novice to being an expert. So how exactly do you become an expert? I want to talk a little bit of the hierarchy of competence, which I think is a famous tool for learning, and which we all know in the medical field, and it has 4 levels of learning. First is the unconscious incompetence. Later you advance to the conscious incompetence. After that you advance to the conscious competence, and after that, the last stage of learning, you advance to the level of unconscious competence. And this is something I would really like to talk a little bit more about in detail. So the first level of learning is unconscious incompetence. For me, always this is a very funny stage of learning, and you can see it when you look your residents who have just started training. And when you observe them good, you see that the individual doesn't know what he's doing. He doesn't know the theory, he doesn't know the skills, but also he doesn't recognize the deficit. And even he or she can deny the usefulness of the skill. So you really don't know what you are doing, and you must really recognize your deficit or the usefulness of the deficit before you can move on to the next stage. When you have recognized your deficit, you can enhance to the next stage, and that is conscious incompetence, where you actually recognize your deficit and you recognize the value of your skill, but you still need to learn it. So you will make a lot of mistakes during your learning process, and you try to keep practicing and practicing. And if you have managed to go through this stage, you advance to the next one. The next stage, which is conscious competence. Now you really start to know a skill, and you can demonstrate the skill. You have learned something, but it still requires a lot of concentration, and it's maybe broken down into steps. For example, a very difficult procedure like any surgery or induction of a patient for cardiac surgery or whatever surgery, you can break down into different steps and go step by step before it becomes second nature. So you still need heavy conscious involvement before in executing the skill. And if you learn more and more, you come to the unconscious competence, which is the last stage of learning, which you hope to achieve after following this fellowship. You need much practice, and the skill becomes second nature. The skill is easily performed, and you can perform the skill also when you are executing other tasks. So you can multitask. And I always say to my residents, you do not know what you know, and the benchmark is what you know today. Your benchmark is what you know today, and you don't realize what you have learned to reach this stage. So for you, what you know today is normal, and you want to gain even more skill or more know everything about your field. So this makes it hard also a little bit to compare yourself with people who are less experienced. For example, residents or especially starting residents. So how did I become an expert? This is a picture of the hospital where I work and where I was trained in during my fellowship. It's the Maastricht University Medical Center. It's actually an accredited center now for the fellowship program, thanks to Dr. Jan Schreiber, who made a lot of effort to start the fellowship and to expand the fellowship and write the curriculum. So thank you. So I want to talk a little bit about the EACTA Fellowship in cardiothoracic and vascular anesthesia. If we go back to one of the first slides where we defined what is an expert, it was important that you have a broad and deep competence in terms of knowledge, skill, and experience, which you gain to practice and education. So how can you reach this stage? At least how did I reach this stage? Well, knowledge and education, I think it's always a good way to start with a basic textbook, and you can read something about your field, the basics, get to know the basics, and if you move further on and further on, you can look into journals and broaden your knowledge. Also, you can go to different courses, you can follow presentations, you can go to conferences, all in your field, and every day you will gain a little bit of knowledge. Here's an example of the EACTA Echo course, which I will talk about a little briefly. So during my fellowship, I did specialist training. I had 2 weeks training in TTE instead of TE. I went to the TTE lab in our hospital and I talked to the cardiologists, and they kindly invited me to come for training for 2 weeks, and I performed 2 weeks TTE exams together with the specialist nurses who performed these exams, and I really learned a lot, and you really learn how different it is from TE in interpreting. Also, I went a 2-week cardiac catheterization training. Also in my own hospital, the cardiologists again welcomed me, and I followed them during two weeks in the cardiac catheterization lab. And I really gained a lot of knowledge about cardiac catheterization and also about the coronary anatomy. And it was very useful. And last but not least, I went for an exchange program with the University of Leuven in Leuven, Belgium, where I was hosted by Professor Stefan Rex, for which I say great thanks, because it was very, very entertaining and I've really learned a lot there. So this exchange program, I gained more insight in several fields which are not practiced in our hospital. For example, congenital heart surgery. We don't do congenital heart surgery in our hospital, so I never saw it before, and it was really, really helpful to me. Also, we did lung transplantation, several. We did one heart transplantation during my exchange program, and also it's good to see cardiac surgery in another hospital than your own, to see how other people practice their business. So, skills, practice, and experience. How do you gain that? Of course, you need to learn a lot of practical skills when you enter the fellowship, like placement of arterial and central venous lines, pulmonary artery catheters, but also TEE is very important. And you need to learn other skills like knowledge about inotropics, vasopressors, one lung ventilation, weaning from cardiopulmonary bypass, etc., etc. And of course, you have some knowledge of this when you're already a general anesthesiologist, but during cardiac surgery and the cardiac fellowship, you can really learn a lot of things and gain a lot of experience. So like I mentioned before, the EACTA ECHO course is a very handy and very useful and very good course about cardiac ultrasound, especially TEE. It's divided in several courses. The basic course, which really is about physics and other basics of ultrasound, the hands-on training, which was great, where you really learn about practical things. The advanced course for when you have a little bit of more experience, and of course the certification course, when you are interested in doing the certification exam of the European Society of Cardiology, which I can really recommend to everybody who will follow this fellowship. I think this is the good time to do this certification. So I would like to talk and show you a little bit about the numbers I gained during my one-year fellowship. I think when you are quite active in your fellowship, I did only cardiac and thoracic surgery during the whole year of my fellowship, so no other surgeries. You can gain a lot of, quite a lot of numbers. And for example, I did 225 cardiac surgeries, but this includes also TAVIs. I did 54 thoracic surgeries like thymectomy or lung surgery, 12 major vascular surgeries, which were all aortic surgeries, and 3 cardiology procedures, which were mitral clips. And during my one-year fellowship, I managed to do 130 full TEE exams. So I just want to show you a little bit about the diversity in procedures which you can gain knowledge about during this fellowship. Of course, this is for our center, but I think it's comparable to all fellowship centers. Of course, there is the coronary artery surgery, you have the ascending aortic surgery, the major aortic surgery like arch surgery. There are special hybrid atrial fibrillation and ventricular tachycardia procedures in our hospital. There is, of course, all valve surgery, and there is minimal invasive valve surgery like the mini-mitrals, the TAVI procedures, and the neocord procedures. And also the Moreau procedures is sometimes done in our hospital. So, of course, also you do thoracic surgery, and some examples of thoracic surgery which you can do is thymectomy. We do a lot of thymectomies in our hospital, robot-assisted. We are a referral center for this procedure in myasthenia gravis patients. Mediastinoscopy, thoracoscopy, lung surgery like lobectomy, pneumonectomy, etc., etc. And also we are a referral center for open lung volume reduction surgery in COPD patients. Vascular surgery is also a part of the fellowship. We do a lot of endovascular procedures. All types and kinds of endovascular procedures are being done in our hospital for thoracic and abdominal aneurysms of the aorta. We do also open surgery for abdominal aortic aneurysms, but also thoracic abdominal aortic surgeries. And examples of cardiologic procedures in our center are, for example, the mitral clip procedure, which we do also. So after having done all of that, are you an expert now? I think quite. You're not quite there yet, but it's a great preparation for a further career in cardiothoracic anesthesiology. And there was something I found on the internet, and that is Malcolm Gladwell's 10,000 hour rule, which states that if you want to become an expert in a specialized skill or in any field, you must do 10,000 hours of preparing and practicing. So that I didn't met yet, but I'm on the way. So to finish, I think I want to wish everybody good luck, to all future fellows, and also to the future centers who are thinking about hosting this fellowship. I think it's really a recommendation. The fellowship was great. So that's what I want to end this presentation with. Are there any questions?
Yes, there are any questions, of course. Hello, Anna.
Hello.
So before we go on with the questions regarding your presentation, which was excellent, I would like to answer 2 or 3 questions which came from other centers and people who are interested in some general aspects of the fellowship. The first one is from Saudi Arabia, and this was a center who is providing a fellowship program on national basis, and they want to apply for the EACTA program. So I would like to ask you to contact the Educational Committee of the EACTA. You can find the addresses at the website. You can find additional information about the application process at the website of the EACTA. It is www.eacta.org. Then a second question from somebody who is working in Belgium now and who wants to apply for a fellowship in Italy. Is that possible? Yes, of course it is. You have to have a language proficiency, of course, and you have to have an European registration as a medical specialist, which has to be recognized in the country you want to go to, which means Italy. Normally on EU level, Belgium, Italy, that shouldn't be a problem. And the third question comes also from Belgium about the endpoints of the fellowship. Are there any endpoints, number of procedures, for example, a theoretical exam, an echo exam, or does the host center itself determines whether the fellow has fulfilled our requirements? Yes and no. There is a defined number of procedures the fellows have to fulfill. There are no exams at the end, no required exams, and the fellows are prepared to do the echo exam, but it's not a requirement. That's the same approach does the EACTA in the United States. So what we are doing during the fellowship, of course, is we do a quarterly assessment of the fellow. We do a 360, like Vera said, a 360 degrees evaluation. So the evaluation of the fellowship and the progress is done at the center. So these common questions in the beginning. Now we're going to Anna. Hello again.
Hello.
And the first question comes from somebody who wants to know if there is any age limit for a fellowship.
Actually, the issue is not how old are you, but if you are ready to do the fellowship. So are you ready to work hard? Are you ready to abandon your comfort zone? Are you ready to learn from other people? Because the problem is, if you are quite old, maybe you have a lot of experience, and for you maybe it's going to be difficult to accept that other people control you or just teach you. So if you are ready, there is no problem. The age is no issue.
Okay. So it doesn't has any effect on the selection process or so. This the age is not really a criterion. So you must be willing to do hard work.
Exactly. And be ready to accept to learn from other people that maybe are younger than you.
Okay.
Yeah, that can be a problem. If you are quite old, maybe the people who are teaching you are younger than you, and you have to be ready to accept that.
Yeah. I think that's
if you are open-minded, if you want to learn, there is no problem. The problem is if you find that it's quite difficult, or you are not going to accept that. And so, but normally in the interview, it's an issue that the people who ask or perform the interview and are quite all talk about that all that issues, and we can see if they are going to fit in the department or not. So, but per se, age is not an impediment.
Okay, just about the interview, do you have any tips and tricks for the interview? Some things people should know about the selection process, or some hints to perform in an optimal way during that interview?
So I think that the optimal is if the applicant can come to the department to stay with us 1 or 2 days to see how do we function, because then we can talk about a lot of things. They see how do we work, they can talk with other fellows, they see how are the behavior in theater, and then we sit down and we talk about. I try to know what kind of experience do they have, where do they come from, if they are ready to. Most of the non-EU fellows when they apply, they don't talk German, but we do the interview in English, and we try to communicate as much as possible. And I think that's not a unique trick, because all people are different. So I just try to ask what are they doing the last time, and sometimes some questions about some specific illness or performances, just to see how they do react on, or if they are going to fit in the department. And if they cannot visit us, that's more difficult. But we try to at least to have one interview with 2 of us. We are co-directors, because we come from different countries, we have different cultures, and we can analyze the things from 2 different points of view, and then that help us to decide if that person is going to fit in our department.
Yeah, it's a little bit like our approach in Maastricht. So we held the interviews with a group of 4 to have really broad-based opinion, to get a broad-based opinion about the applicant. There is another question. That's a little bit unfair, but would you recommend an EACTA fellowship instead applying for an independent fellowship at a specific cardiac center?
Yes, I think that the EACTA fellowship has it's a structure, and it's comparable in the different centers. If you apply as an individual person in an individual center, maybe you have luck or not to have a good mentor. And I think that the EACTA has sometimes for us, for directors, it's quite strange, because we have to report all the activity. But that's an assurance for the fellows, because they know that somebody else is controlling the quality of the fellowship.
Yeah, I think that's really a big advantage, that there is a structure behind it, and the whole thing is based on a structure. Another question, and that's the final one. Do you have any problems due to the COVID-19? Are there any disruptions in your program in Leipzig?
Well, in Germany, there was no first wave. At least in Leipzig. So in Leipzig, during the first wave in spring, there was no problem. Now, the last 2 weeks, there are some problems. We have some COVID patients in the hospital, and some consultants have to attend or co-attend the ICU. So, but the fellows till now are staying with us in theaters. Maybe they have to do more night shifts just because other consultants have to attend the ICU. But till now, they are following the quality of fellowship.
Okay.
We don't know if it goes worse, if we are going to need them, but till now they are just staying with us in theater and PACU, and they are following the normal fellowship.
Okay. Okay, thank you very much. So thank you very much for your excellent talk. We'll go on with the next speaker, and I want to thank you for your presentation, and have a good night and stay safe in Leipzig. Thank you. We'll now go on to Luis, who joins us from where? From Canada.
Yeah.
Yeah, great. On the other side of the ocean. Luis, you have told us about your experiences as a non-EU fellow in Milan. And there is a question, can you tell us a little bit about job prospects after the fellowship, especially for non-European candidates, even if they are from a probably developing country? Did you feel any advantages due to the fellowship? There are no working in Canada. Did it make did you feel any progress or any advantages due to the fellowship in Milan?
So I guess that the first thing in Milan, for example, Italy needs anesthesiologists, right? So I mean, if you do the whole process, right, you get your license, you do your fellowship, you know, it's very your chances of getting a job are high, right? But if you have the whole process, and the process is very long and hard, but if you do it and you do your fellowship, the chances of getting a job are high, right? Then, I mean, in Canada, the things are quite different, but I mean, my experience in Europe was that if you have all your license, everything in order, the chances of getting a job are very high, yes. Even though that you come from a different country or whatever, it doesn't matter as long as you have your license and everything ready to go. Yeah.
Okay, thank you very much. So I would be interested in you was coming from abroad to Italy, and how hard was it to build up a network and to you told a lot about different cultures. You should be familiar with a different culture if you're coming into a country, if you're coming to another place. How difficult was that, and what did you do to cope with it?
Good, right. So unfortunately, there is no silver bullet, right? There are many difficulties, and we can't go through each one of them. But I think that it's very important to contact previous fellows, right, and build a network and a communication with them, because they already know the process and already done it, right? So that's the first thing. And second, the language is going to be essential. Maybe not at the professional level. So I guess my advice is to learn the basic language and travel as soon as possible to the country. And then you can get your professional language level being in the country and knowing the culture. So I guess that's the best advice to begin. Let's say that you don't know the language, you want to start from zero. You can learn the basic language at home and then travel as soon as possible. Contact previous fellows, contact the program directors. They are aware of how difficult the process is, and they're very helpful, but you need to let them know that you're interested and you wanna go through it. And then be very resilient, right? There are many things you're going to see in the way, but that happens, you know, in Canada and Spain, any place you want to go, you know you're going to have difficulties. Maybe it's a little bit more difficult because of the language, or if you're beginning from zero. But other than that, is the normal path anyone has to do to go into a fellow in a different place. Yes.
Okay. When you did start learning Italian, you did that at home with online courses, or did you go to a language school? How?
Well, I guess that my experience is a little bit different because I learned Italian from very early. My mom and the family from my mom is from Italy, so I had a little bit of advantage, let's say, because of that, right? But I do know the previous fellows that went to Milan. One is from Canada, and one is from Russia. So there are a lot of different and very broad experiences. And I mean, everyone has started from Duolingo, at home, and then escalating to getting more deep in it. There are so many tools right now. But I do think that the best way of learning it is being in the country, right? So you can begin learning a lot, but when you get to the country and you get, to talk and to be really there, that is when you're going to actually get the language and hear it and everything. So, but you can begin very easy with the Duolingo, and it's gonna help a lot, right?
Okay, so I got one more question here. You were in Milan, and I know from the program that Milan is a self-funding program, so you have all to take the expenses on yourself. But if you have a scholarship, is it possible to live in a city like Milan, which is in my I haven't lived there any time. I haven't lived there, but is it possible to do? Because I can imagine it's an university city. It could be quite expensive to live there.
Yes, it is. I mean, it is tough. It is expensive, but it's totally possible. I've been lived there with my wife, and I mean, it's possible to cope with it. There's always solutions. You don't have to live in downtown Milano, right? Near the Duomo. I mean, you can live. There's a good transport, and you can live a little bit outside the center. It's going to be cheaper, and it's definitely a way of going through. So, if you get a scholarship, you can definitely do it without any problem. Yes.
Okay, thank you very much. Thank you very much for your talk. Very impressive, and for all your experiences. And I wish you good luck in Canada, and probably back in Europe again over the time. Thank you very much.
Thank you.
Okay, let's go on. The third speaker, Vera von Dossow from Bad Oeynhausen in Germany.
Hi, sorry.
Hi, Vera. No problem.
Can you hear me? Can you hear me?
Yeah,
okay. Because I'm sitting here with our EACTA Fellowship in one group. So because we have only one browser.
Oh, one browser that works. No, that's unfortunate. Okay, but you can hear me, and I have a lot of questions for you.
Okay.
So the first question is about the problems in non-technical skills. You have highlighted a number of that, but how do you teach that in Bad Oeynhausen? Do you make use of a simulator room? And if you do simulation, are you doing that together with perfusionists or surgeons? Can you tell us a little bit about that?
Yeah, we have a model of simulation with the perfusionist, but we wanted to integrate it this year, but then the COVID crisis came, and so we teach together in the OR the treating COVID patients, for example, simulating a situation of rapid sequence induction and prone positions. And for the next year, we plan to integrate this in the with the perfusionist and with the critical care nurses, and to integrate this in the fellowship program. So it is. We have such a simulator. We have also the TE simulator. So every one who starts with the fellowship starts with this TE simulator as well. So I think it's important to And now we are establishing an SBAR concept because we had a structured protocol on the telephone call for on the intensive care, with the intensive care unit colleagues, and it was not sufficient enough. So we have decided to implement this. So we are still on implementing these things in the fellowship, and I think it's very important.
Yeah, there is one more question in this way about the crew resource management, which is also a part of anesthesia training. In the meantime, are you going to implement that as well in your skills training in the simulator?
Well, I think we have crisis resource management in the whole hospital in several times a year. So all the colleagues have to participate once a year in such a crisis resource management. However, there's still room for improvement everywhere. So I think it's also important. But you can include it in the simulation process, for example.
Yeah, you talked a lot about communication training, but you mentioned also that there is a need for training in decision making and situational awareness. Are there any ideas how to train that?
Well, I think at first you have to train the clinical routine. So if the communication works very well in the clinical routine, it is also possible that in worst case scenarios or in emergency situations, it works as well. However, it's very important. We are a very huge center with 11 workplaces. So we have also lots of people working together and different. So what we try to reach is like a airplane standard, like Lufthansa standard, like all those in park and all those in flight. So everyone knows what is now important to do.
Okay.
It's, I think, important to improve.
Yeah. So what would you think about? We are talking about this ANTS, is anesthesia non-technical skills, but imagine you have a fellow and he or she is not doing as well as you want to. So the progress is limited. What would you advise? How to deal with people who don't make the progress you want to make?
Well, I think you have to improve the educational progress. So I think it's they need more feedback. So every 3 months they receive a feedback, and I think we have a very flat hierarchy in our departments, and the fellows are very close to the instructors. So they communicate the whole day. So it's not only every 3 months with the program director, but they have the direct support of our supervisors and the instructors, and they are working in difficult cases together with them, and also in the night shifts when they have 24 night shift. They are not alone, but they are supervised in difficult situations. So they learn also from the instructor, and I think this is the close collaboration with our 10 instructors is very, very important.
Yeah. Would you recommend to do? Normally, EACTA asks for 1 360 degrees evaluation per fellowship. Would you recommend then? Would you recommend then to do more than one of these 360 degrees evaluations during a fellowship if somebody is struggling with the progress?
Well, I think it's important that every couple of months you have a 360-degree evaluation from different persons.
Okay.
Because otherwise the fellow cannot improve. Because and I think it's not enough that only once per year. So I think it's a good process that we are. It's okay. It's hard work to collect all these 360 degrees evaluations, because not all colleagues are integrated in the fellowship program. However, the instructors, for the instructors, is all very important to give this 360-degree evaluation, because they supervise the progress of this.
Yeah. Now, what I've learned is that EACTA made the things quite simple and quite easy for the centers. So they designed an online opportunity for giving the 360, which is anonymous and which only reports to the fellow, which should be the aim of a 360 degrees evaluation. Okay, I have a last question, and that's an unfair question. What particular center do you recommend? Your own, of course.
Oh, I would prefer to go to every center in Europe. So I would like to prefer to go to I'm just for English speaking and all the in Swiss or in Italy or in Milan or in Greece. I think we have to just organize fellowship meetings, like webinars, like this one. This is the initial webinar that we organize now. So I think it would be interesting to have all the fellows together and then to communicate. I don't know. I'm curious. I would like to see all centers. I would like also to come once to Maastricht, for example.
You're welcome. At every time.
So
no
I think we can learn from each other, and this was I told from the Asmussen frame expedition. I think if we take together all the knowledge from all centers, we can improve together.
Yeah, great. Thank you very much for your great lecture, and I wish you a very nice evening. Greetings to Bad Oeynhausen, and stay safe and healthy. Thank you very much.
Thank you very much. Bye-bye.
And we will go on with our last speaker, Ralph Düding. Hi, Ralph.
Hello. Good evening, everybody.
So great. Thank you. Thanks for your experience. And I have one question I would be very interested in, and because it's personal. What did you miss?
What did I miss?
Yeah. During your fellowship?
Oh, that is a hard question to answer. I think I didn't miss a lot of things because we really, of course, you were my tutor, so we had a lot of communication. I think during the fellowship, I completed the fellowship in 1 year, and as it went on, we discussed several things. We had many moments. We discussed how things are going, what we need to add, what we need to leave out. But if you mention it like that, maybe if I can say one thing, it could be good to add a simulation training, like some other presenters have talked about. Of course, in Maastricht, we do a lot of simulation training during the normal residency in anesthesiology, so we are quite familiar with the process. I think we have a nice center for this, but maybe we could incorporate that in the fellowship, and maybe we could try to involve the perfusionists and the cardiac surgeons also.
Yeah, that's a good point. We think about it since we started with the fellowship. It's one idea to do it and to intensify that, and we now have a TEE simulator since 2 weeks or so. So there will be more opportunity to make use of the simulator, especially for the non-technical skills. We should improve that. That's a really good point. Do you think that 1 year of fellowship is enough for the basic training, or should we think about an extension?
No, I think for the basic training, 1 year fellowship is enough. I think I finished the fellowship now 2 years ago, and still you continue learning, of course, after finishing the fellowship. But I think as a basic training, I showed the numbers I reached during the fellowship of 1 year. I think for the basic training, it prepares you for most of the practice. For example, after completing the fellowship, I was confident in doing shifts on my own, doing type A dissections in the night alone. So I was quite confident to do that. And of course, still even today, when you have a difficult case or something which you don't understand, we always discuss with several colleagues. But I think, and that is always possible. So I think for the basic training, 1 year is quite okay.
Yeah. You talked about the process of learning and how to that you will make mistakes in the first time. So how did you deal with these mistakes? Because sometimes mistakes can be quite hard to deal with.
Yeah, of course. It's always a bit hard also for your ego if something goes wrong. So for example, small things, when you puncture a carotid artery during central venous line placement, it's always quite hard for my ego. And of course, in the beginning of the fellowship, it happens not a lot, but several times. And you see also during practice and during enhancing in the fellowship, incidences of such occurrences really reduce. So you really learn a skill, and that is just a very simple example of a identifiable skill in our practice. But you have to deal with it. Most of the times, of course, this has no consequence for the patient. In very rare occurrences, it can have consequences. Fortunately for me, it never had any consequence for the patient. But I think if you make a complication which has lasting problems for the patient, or any even death of the patient, it can be quite hard. You have to deal with it and talk to your colleagues. And fortunately, until today, I didn't experience such a thing, but it can be a challenge.
Yeah, I think it underlines the importance of simulator training, and that we should improve that, at least in Maastricht, and hopefully in the other centers as well.
Yeah.
So I have 2 more questions, which are more in general, not specifically for you. Mm-hmm. One is the question: is experience as a cardiac surgeon, as a consultant, will play a positive role for the fellowship? Yeah, I don't know that, because it depends on the center where you want to apply. You have to be a senior registrar or specialist in anesthesia if you want to apply for the fellowship. So it's not, I know that from my own experience, I got several applications from surgeons. It's not a surgical fellowship, so you have to be an anesthesiologist to apply for this fellowship. And then if another question about the employment situation of fellowships, of fellows after their fellowship. We have provided a survey among the fellowships last year, and the results are not published yet. We have shared them during the last EACTA meeting, but we will publish them as soon as possible. So there are experiences and some reports about what the career of our fellows did, and if they felt any improvement by joining the fellowship for their own career. So we know a little bit about that, but there are not much data about that, and we need to evaluate that continuously. So for every new or future fellow, you should expect a survey at the end of your fellowship that we can learn from you how to improve the fellowship itself. So these were all my questions I have. Thank you very much, Ralph. And I would like to give a short wrap-up of our webinar today before I switch over to Mohamed Tahan, who is chair of the Educational Committee. So if you want to go for an EACTA fellowship abroad, be prepared for it. So you should know about the requirements. You should know about probably the cultural differences. Language is a very important point. Unfortunately, this is a little bit more difficult in Europe than in the United States, for example. So be prepared, even not only for the requirements, but also for the cultural differences, and know about the place, learn about the place you want to go to. The fellowship is not only something to provide medical skills, to learn your medical skills and tricks and knowledge. It should improve you, or it should help you to improve your non-technical skills, and that's one of the main aims of the fellowships. And therefore, we have implemented things like 360 degrees evaluations, quarterly talks in the fellowship program to help you to become a better anesthesiologist, even with focus on non-technical skills. And these are as of equal importance as the anesthesia skills, as the medical skills. And finally, it's a great experience, but you have to be open-minded. That's very important. As you have heard, people from different cultures are working together in the great heart centers. You have to be open-minded. You have to accept the competence of other people. You have to work into a team, and you should be able to work in a team. You must be open for that. That's very important to get the most of your fellowship. And with this wrap up, I would like to switch to Mohamed El Tahan, who is the chair of the Educational Committee of the EACTA, who has organized this webinar, and also on behalf of my colleague Gabor Erdoes, who can't be here tonight. I wish you a very good night. Stay safe and healthy until the next time. Thank you very much.
Thanks so much, Jan, for this interesting moderation for this session. First of all, I want to appreciate and thank Professor Vera von Dossow and Dr. Anna Flo Forna for this initiative to start this session. It has been supposed to be on site during the annual Congress, and as you know, the EACTA annual Congress was held virtually. So thanks to Flo app, they provide this platform for you to increase the communication, to strengthen the communication between fellows and the program directors during the first webinar for fellows. I have to thank all speakers and moderators for all great efforts and valuable times invested for technical sessions and rehearsals and to do this live webinar. All unaddressed questions, it will be answered and posted on EACTA website. Subsequently, we will set the notification on the 4 platforms of EACTA on social media, on LinkedIn, Facebook, Twitter, and Instagram. Meanwhile, you'll find the answers for the take-home message also on the website later on. And I have to thank the organizers from AM, the EACTA Secretary, for the great efforts to organize this event. Final words, I want to remind all of you about the next EACTA webinar. It will be on March 29 from the Pediatric and Congenital Subspecialty Committee on fast track and air extubation after pediatric cardiac surgery. Don't miss it out. It will be CMA accredited. And I wish all of you happy festive holidays and Merry Christmas. Thanks so much for your attending tonight, and see you later on next year.